Welcome, everyone. Good afternoon. We are glad you joined us again for our Q&A session with the media that we do once a week on Thursdays, an opportunity to give an update on what's happening at a state level as well as a local level related to COVID-19, and an opportunity for media to ask some questions. I know we got a couple of questions in advance. I will walk through our basic information, answer those initial questions, and then Audrey is with us as usual to help moderate questions that come in via chat or questions that you'd like to ask out loud after we walk through the beginning portion. I hope everybody had a good Thanksgiving, both safe and happy, as well as some full tummies. It was a challenging Thanksgiving for many of us. Often it's a time where our extended family gets together and where we really take time to pause and be together as a family and as a community. And it was a little different this year for most everybody. Really making sure that one another was safer in this environment was critically important. I know that our family did a Zoom connection on Thanksgiving Day and had some time with each other. My brother's Thanksgiving dinner in Milwaukee looked really delicious. And I think many of us had that kind of experience as well. The choice to be safer was really important, and we hope that plays out in the weeks ahead. We'll be talking a little bit more about that, but really, again, with this 14-day incubation period, we will see the results of choices that people made related to deer hunting, related to Thanksgiving, related to this time of year celebrations in the weeks ahead. And we're hoping for the health and safety of this community that all of us are making wise choices. As we go into the December holidays that are upcoming, there still is a lot of risk of spreading COVID-19 and impacting negatively those people in our community that we love and care about. I know that many people already are thinking about how their holiday celebrations will happen. Again, there is no easy solution to this respiratory disease. It is very contagious, and when we're in close contact with one another and with people that we are not living in a household with, the risk is there. We are hopeful about the coming vaccine. The vaccine is not going to be a magic solution in the next several weeks, months, and maybe a bit longer than that for the general public. For this holiday season, we need to use those same basic strategies throughout December and early January, when we otherwise might be having family celebrations, work celebrations, those kinds of gatherings that are important for all of us. We need to pay attention to 6 feet, wearing a cloth face covering, and keeping our circles very, very small. We hope that people find some really fun, creative ways to connect virtually this season. So I'll start with a state status update. As we usually do, we'll walk through that and the local data as well. We now have 2,169,970 negative tests for COVID-19. We've had a lot of testing happening in the state since last year, March, and that's really testimony to the importance of testing being part of our strategy in the state. More than almost 45,000 negative test results have come in the state since last week when we talked last. We now have almost 400,000 people in Wisconsin that have tested positive for COVID-19. We are at 399,708 individuals that have tested positive for COVID-19. A little over 25,000 since last week, Thursday. Today, all 72 counties are having very high or critically high disease activity levels. So everywhere you go in Wisconsin, we are seeing COVID-19 disease spread happening. 17,741 people in Wisconsin have been hospitalized for COVID-19, an increase of more than 1,000 individuals since last week, Thursday. And we now have 3,562 fellow Wisconsin residents, family, friends, neighbors, who have died related to COVID-19, an increase of 322 individuals in our state in just this last week. We set another record, unfortunately, this week for newly reported deaths in a single day. On Tuesday of this week, we had 107 people reported as having died related to COVID-19. We know that as our case numbers go up and as our hospitalization numbers go up, which happened over the last couple of weeks, that our death numbers will also go up. So this is a direct result of having more cases of COVID-19. The harder we can work together on decreasing the case numbers and decreasing the number of people that need to be hospitalized, the more likely it is that we will have fewer deaths related to COVID-19. The state 7-day average positivity rate by people tested is at 31.7% as of yesterday. The positivity rate by test, so all negative tests that any one individual has done is counted as a test, is at 13.7% as of yesterday. Again, positivity rates that are much higher than what our goals are as a state. In Eau Claire, our test data is that we are now at 38,522 negative tests for COVID-19 since the start of the pandemic, an increase of more than 1,000 since last week, Thursday. We now have 7,956 people in Eau Claire County that have tested positive for COVID-19, almost 8,000 people in our community, an increase of 393 people since last week when we spoke. It's an average of about 56 cases a day. You may note that's a significantly lower 7-day average than what we've had the last 2 times we've talked to you. And it's a good thing. Our 7-day average for daily case report is still well over what we are hoping for in a space where we can be more comfortable with the disease spread. Anything over 30 cases is considered very high disease activity, and we are still at 56 cases for that 7-day average. We're glad, though, to see it down, and we are hoping that that trend continues. Our previous 7-day average was 112 cases a day, and that was last week when we reported that. We're seeing those decreases across the region and across the state. The positivity rate in Eau Claire, the 7-day positivity rate by person, is at 29%, which is now lower than the state rate, that 32%, which I shared earlier. Our by test positivity rate is in the 12% area, again, down from the previous report. We now have 6,442 of the individuals that have tested positive that are recovered. A remaining 1,407 individuals today are still isolating because they have COVID-19 and could potentially spread it to others in the community. Those we are actively working to make sure that they remain isolated and we have the lowest spread possible from those people that are positive for COVID-19. 248 Eau Claire residents have been hospitalized since the start of the COVID-19 pandemic, an increase of 9 since last week. We are now at 59 Eau Claire County residents that have died related to COVID-19, an increase of 2 since last week. The State Health Department is listing 60 active investigations, public health investigations, 25 long-term care facilities. The remaining are educational facilities, group housing, workplaces, healthcare facilities, and then other general settings. We remain in the critically high activity level named by the state for those places where we have more than 1,030 cases in that 2-week period. We've had more than 1,300 cases in 2 weeks. Our goal is 150 cases in that 2-week period. So again, greatly exceeding what our goal is. Jail testing data, we are now at 271 individuals that have been tested connected to the Eau Claire County Jail with 21 positive cases and 20 recovered cases. UW-Eau Claire data that we have today is that about right around 16% of our cases since the beginning of September are connected to UW-Eau Claire. UW-Eau Claire does continue with their testing strategies, and even though their classrooms are all virtual now after Thanksgiving for the rest of the semester, they do continue with their testing protocols for both dorm residents and for those faculty, staff, and students that are off campus, as well as for community members at the Memorial High School testing location. Just a quick announcement about a couple of things. First of all, we are working with the state on the recent announcement yesterday that the Centers for Disease Control has made adjustments in their recommendation related to the quarantine recommendations. Again, a reminder that quarantine is for people that are close contacts of those individuals that are positive for COVID-19. Those people that are positive need to stay home. We call that isolation. Those people that are close contacts are needing to stay home as well because they may have become infected. It's a very contagious disease, and if you're a close contact, there's a high likelihood that you are also going to be a positive case. Because many people are asymptomatic or minimally symptomatic initially, staying home so you don't spread to any additional people while you are in that incubation period, that 14 days where you may yet get the disease from that exposure, is critically important in our community strategy to slow down spread. That 14-day period, CDC has decided to move forward with a recommendation that while 14 days is the gold standard, those people that do everyday symptom monitoring, so they make sure they're monitoring their symptoms every single day for COVID-like symptoms, can do a 10-day quarantine. And they've also indicated that for those people that have available testing, a full 7-day quarantine is possible, where on the 8th day, it is possible to potentially be released from quarantine with a negative test. Because we are a local health department in a state health department where really the requirement for us is to follow state guidance from our state epidemiologist and how we move forward with disease investigation and control. We are working with the state now as they are making decisions based on the CDC guidance that we all just received on how we will move forward in Wisconsin. We hope to know more by tomorrow or early next week, and we will be updating our protocols and practices and all of the guidance material that we have in accordance with what the state plan will be based on the CDC recommendations. Again, this will be based on testing availability. This will be based on the state look at our local data in Wisconsin and what is necessary to slow spread of COVID-19 in this state. We will make sure that everybody is aware of that change, and we'll make sure that all the information that's available to residents in Eau Claire County is updated to correspond with whatever change comes forward from the state. The metrics are also released later on Thursday, early Friday morning, so we will have those available soon on our website. Those are the measures that we are tracking related to our Respond Together plan. It's the measures that we are making sure we're watching to see how we ebb and flow with disease spread in this community. I'll walk through some of that data, and certainly please encourage you to go to our website, the COVID-19eauclaire.org. If you go to the data tab on that website, you'll get a lot more information, including the documentation of these measures. Our testing has been lower, first of all, in this part of the state, in our county, as well as across the state. We know that during holiday weeks that is not unexpected. So our testing volume did go down significantly, and so we are tracking that as part of our measures. We are at yellow and decreasing for the hospitalization bed utilization in this region, and the ICU bed utilization in this region. Those are good indicators. That means we have fewer people right now that are needing the hospital capacity in order to respond to really serious issues with COVID-19. That's an important pivot from 2 weeks ago, and we hope that holds. Again, it's very dependent on all of our actions in the next number of weeks. We also, though, do know that healthcare facilities continue to be facing critical staffing shortages. The less COVID-19 we have in the community, the less COVID-19 we'll have with our healthcare workers that we need to be working and healthy. So all of us really can influence that as well by making sure we slow down spread. So we're not inadvertently spreading COVID-19 to critical workers in our healthcare settings, our assisted livings, our long-term care facilities, our hospitals. We are now at 16 new outbreaks in the last 2 weeks. That's in the red in our measures. We are at 37% for community spread. That is an increasing indicator, which means that we have more spread happening in the community where people don't know where they got COVID-19. Not a good sign, and one we need to continue to work on. Again, the smaller our circle of close contacts, the more likely it is that we know who we got COVID-19 from if we get COVID-19 positive test. We now, we continue to report on how our public health capacity is doing. We are now at 50% of our cases getting a call from us within that 24-hour period, which is our goal. As we've shared with you in the past, the more cases we have, the less likely it is that we can quickly get to all of our cases, all of our positive cases of COVID-19, to talk them through what they need to do in order to slow disease spread in the community. That's not to any of our advantage to not be very carefully using public health measures to slow this down. We don't want to resort to only hospital or emergency care measures to help people once they're sick. Our public health capacity is also critically important. So only about 50% of our cases, it's a bit better than last time I reported that to you, and we know that this past week we've had fewer cases, so our ability to get to those cases is much improved with those lower numbers. Our priority continues to be to get to those cases and make sure that they are staying home and not spreading disease across the community. We right now are doing limited contact tracing, if any. That is when we try and call the close contacts of cases. Again, a gold standard in public health. Our goal would be to not only know who all the close contacts are, but to call them individually to make sure that they stay home for those 14 days. We're still not able to do that, so we are asking cases to make sure that they are telling their close contacts to stay home for that full 14 days at this point to make sure that they're not spreading COVID-19 to those people that they come in contact with. We need people to do that. It makes an enormous difference in slowing down COVID-19 in our community. So with that, I'll remind people that our website is covid19eauclair.org. We also continue with our call center number, and that number is available for questions that you can't find answers to on the website. And we encourage you to call 715-831-7425. They will return your phone call during business hours, but certainly leave a message and we'll get back to you as quickly as we're able to. So a couple of questions that we got in advance from the media, and then I will certainly answer any questions that are put forward in chat that Audrey can share with me or that you have once we finish with these advanced questions. First of all, does the health department have any insight on why testing in Eau Claire County is still down a week after Thanksgiving and the opening of gun deer hunt? We do know that, again, testing, as I shared earlier, was down across the state and definitely down in Eau Claire County. We tracked the data for the last 14 days, and we do see that decrease. There are a number of reasons concretely that happened. Some of the testing locations were closed on Thanksgiving Day, and the wing site, the National Guard site, was also closed on the weekend after Thanksgiving. So we do know that impacted our testing numbers and made a difference during that week of Thanksgiving. We also know that some people decided not to get tested during those weeks where they may have been occupied with other activities. They were out hunting or they were engaged in cooking Thanksgiving meals for their household. And we know that during those timeframes, often some of those activities that may not be urgent do happen. So some of that less urgent testing may not have happened during those weeks. And that's what our assumption is at this point. We continue to analyze the data, and there are many questions being asked across the state to make sure that people that need a test are having access to a test and that they continue getting tested as we move forward. Today, there was some conversation that there may be some perception that testing is no longer needed now that vaccinations are available. I want people to make sure they understand that vaccinations are not available right now. They will not be available for some time for the general public. We need to keep doing those basic strategies that will help keep us safer. And that those basic strategies do include getting tested if you have any symptoms or if you're a close contact to someone that is COVID positive. It's also a question about there are many unknowns related to the vaccines, but could we talk a bit about what might be expected when vaccines will arrive to Eau Claire County? Who will be the first to receive and how will that happen? How large of amount of the population will we need to get vaccine in order for it to be effective? And can we resume normal activity once we receive the vaccine? There is still a lot that we don't know about this next stage of our pandemic response, which really is circled around vaccine distribution. CDC is developing actively a plan, as is the state. So really every day there is work being done and we are getting updates related to where things are at with the vaccination planning. And frankly, every day there are pivots happening as we know more about supply, as we know more about the opportunity to target that supply to those in greatest need. The state right now is looking at the prioritized populations that CDC has determined. There is a state level work group that is looking at that population. And as we are finding out at the state level about what the size of the vaccine that will be distributed initially will be, really reprioritizing for those most high risk individuals. The first tier of the vaccine will go to healthcare workers. That has been determined, as well as likely a connection to long-term care facilities. There still is a lot of question about how much vaccine we will be getting in Wisconsin with the first distribution. So that is an eagerly weighted amount. There is some information that the Pfizer vaccine will come first and then other vaccines after that. And we know that we will get vaccine in Eau Claire for some of our very high-risk populations in the healthcare setting. We also know that we have very, very many healthcare workers in Wisconsin, and our first distribution of vaccine from CDC will not be sufficient to vaccinate even all healthcare workers that are in urgent need of vaccine. So there'll be some level of prioritization that happens at a state level for that population. We also anticipate that more vaccine will roll forward from both the existing two providers that we're aware of, as well as other providers that may come online throughout the course of all of 2021, likely. So as we hear more and as we have definitive plans around the next groups that will be prioritized, we'll get that out very quickly to the community. In Eau Claire, what we're doing actively is working with healthcare and working with community partners to identify what the possible mechanisms for distribution might be. The state is also working on distribution mechanisms. So we have to knit those together once we find out more from the state, but we likely will anticipate that there will be distribution of vaccine at healthcare locations and at mass vaccination or public health locations, as well as many, many other places around the community. The goal will be to get as many people vaccinated as quickly as possible. It likely, again, will be a long time before we have sufficient vaccination of our population to be considered to be in a place where there's general herd immunity or protection for all of us in the community. And we hope that happens quickly, but we know supply will make a difference. We also know that the first vaccine coming out, again, is right now not able to be given to those under 18 or to those that are pregnant. So again, there will be certain populations initially that will not be able to get vaccinated. So again, it's all of our jobs to make sure we continue with basic strategies like making sure that we wear a cloth face covering or a face mask, and making sure that we are staying home when we're sick and keeping distance when we're people that are not our immediate household members. There's an additional question about Thanksgiving holiday, which was a week ago today, and if we would expect testing to be busy in the next week, or when people find out they may have been exposed, what we will be seeing. What are the best practices related to getting tested after being at a large gathering? Again, we hope that most people followed the guidance around that we have in our community expectations document in Eau Claire, and that it has been well talked about across the state, that we kept our circle small, just our household and our immediate family for our holiday celebrations. But if you do believe that you were exposed or you did come into contact with someone that was COVID positive over the holiday weekend, really within that 5 to 8 day after exposure timeframe is a good time to get tested. We expect people to stay home and be quarantined during that whole 14-day period. So if you know today that you were exposed to someone because you gathered on Thanksgiving, you need to be home right now. You also need to consider being tested. And a week out, right about now, is a good time to consider being tested. Certainly monitor your symptoms, and certainly make sure you get a test taken if you have any symptoms immediately. The Wisconsin National Guard site is available on Friday from 11 to 7 and Saturday from 9 to 5, as well as on Monday, 11 to 7. Or any healthcare provider testing site would be a good place to go. And we have a lot of testing support in this community. There should be no reason that someone can't get a test. Please look at our website. We have a testing document on that website that walks through all of those available testing locations. And then I would just also let you know that we will be having one more influenza community vaccination clinic. As you may remember, we did one in Augusta and we did one earlier in November in the city of Eau Claire. We'll have one more time where we will be providing vaccinations again to that school-age population, and it's available again to community members across our community. It is Wednesday, December 9th from 3:30 to 6:30 at North High School on the north side of town. It'll be a little different than our previous vaccination clinics. It will not be a drive-through. We're testing out a walk-through site at North High School. Again, part of this is to really explore what are the ways that we can get vaccinations to be done in an efficient and effective way in this community. So we're ready for the spring mass vaccinations that may be necessary for COVID-19. So again, go to our website, echealthdepartment.org, to look at how to sign up for that clinic, and make sure you get your flu shot. If you don't get it at that site, make sure you go somewhere and get your flu shot. Again, flu shots are readily available across Eau Claire County, and it's a really critical strategy to decrease what might be, again, a reason for people to be hospitalized if they don't get their flu shot. We want to keep people safe and healthy for all kinds of reasons, and getting a flu vaccine is an easy way to make sure that you have that basic protection. So with that, I'll pause and see if there are any questions that have come up in chat. Audrey.
Yeah, we do have one question from a media partner on the line, and it's about the City of Eau Claire Wintertime in the City event that is scheduled for this Saturday. It promotes walking on outdoor trails, looking at Christmas lights downtown, grabbing hot chocolate and cider, and potentially checking out downtown businesses as well. Can you speak to how people could attend that event safely if they're interested?
Thank you for that question. And as I've said before, COVID-19 has been really hard on everybody, individually, but also on our businesses in Eau Claire. So certainly events like this to really think about and support our small businesses is critically important. The governor today also announced a number of grants going out to local businesses that are interested in applying for funds that are really have been hit very hard by COVID-19, places like restaurants and hospitality and places that have music venues, for example. So a reminder that that is also happening. For this event that is going on in Eau Claire, safer ways to do that are really those basic strategies that we have been talking about in every forum that we've shared. Keep your distance, only go with your immediate household, and wear a cloth face covering. So you can do that. We know that our small businesses are working very hard to make sure that their environments are safe. We can help them by making sure that we're wearing our face mask when we go into any business, making sure that we stay distanced from others when we are inside, and doing as much as we can outside. Many of the things that are being supported on Saturday are outside activities, and I highly encourage people, if you haven't been in downtown Eau Claire, to go down there, especially in the evening. It's a place that I walk my dog almost every night in that downtown area because of the lights, and it is beautiful. So go and enjoy that. Keep your distance, wear a cloth face mask, and make sure that you are keeping distance if you are going inside any facility. If you have any symptoms of COVID-19, or if you are a close contact of anybody that has COVID-19, please stay home. Please honor the important need not to spread COVID-19 to others by staying home. Any other questions, Audrey?
No other questions in the chat box, so would anyone else like to ask one by unmuting?
All right. Thank you, everyone, again. Please see our website for updated information that comes out every day, as well as our other social media links. We'll be back next week, Thursday, and I hope everybody has a good start to December. Thanks much for joining us.